Have you ever found yourself clearing your throat or coughing up a little phlegm after a good laugh? It might seem odd, but it's actually a common experience. Phlegm is that sticky, protective mucus that lines our airways, helping trap dust, allergens, and other particles before they can reach our lungs. But sometimes it feels like phlegm shows up at the most inconvenient times, like right after laughing. This video will explain why this happens and explore the causes behind that sudden phlegm buildup in the throat when you laugh. Plus, we'll go over some helpful tips and strategies to keep phlegm buildup in your throat to a minimum so you can avoid this unwanted symptom. So be sure to watch until the end. And that leads to the question, what causes phlegm in your throat after laughing? Getting phlegm in your throat after laughing often results from natural respiratory and reflexive responses. When you laugh, your airways and diaphragm experience rapid movements, which can irritate the lining of the throat and cause minor inflammation, stimulating mucus production as a protective mechanism. Additionally, laughing can cause a sudden intake of air, which might dry out the throat temporarily and signal the body to produce more mucus to compensate for the dryness. For some, underlying conditions like allergies, acid reflux, or respiratory sensitivities can also contribute to phlegm buildup in the throat. If the issue persists or is accompanied by other symptoms, it might be helpful to discuss it with a healthcare provider to rule out any underlying conditions. But now, we need to talk about phlegm's function in the human body. As previously mentioned, phlegm serves a protective and essential role in our bodies. Primarily, it helps trap and expel foreign particles such as dust, bacteria, and allergens, preventing them from reaching deeper parts of the respiratory system. Produced by the mucous membranes in the airways, phlegm contains antibodies, enzymes, and proteins that work to neutralize pathogens and aid in immune defense. Additionally, phlegm helps maintain moisture within the respiratory tract, ensuring that delicate tissues don't dry out or become irritated. While most phlegm is thin and unnoticeable, its consistency may change in response to irritants or infections, resulting in thicker mucus as the body ramps up its defenses. Therefore, phlegm is crucial in maintaining respiratory health and protecting against potential threats. Now, let's discuss the causes of increased phlegm production. Phlegm in the throat can result from several factors that stimulate the body's mucus production or irritate the respiratory system. One of the primary causes of phlegm in the throat is postnasal drip. While nasal secretions increase, such as during allergies or a cold, excess mucus can drip down the back of the throat, causing irritation and leading to phlegm buildup. This postnasal drip is especially common in individuals with seasonal allergies, sinus infections, or colds, where the body produces additional mucus in response to inflammation. Similarly, respiratory infections like the common cold, flu, or bronchitis often cause increased mucus production as the body tries to expel viruses or bacteria, resulting in phlegm in the throat. Another significant contributor is acid reflux. Acid reflux, or gastroesophageal reflux disease, occurs when stomach acid travels back up into the esophagus and sometimes reaches the throat. The acidity can irritate the throat's lining, prompting mucus production as a protective response. Individuals with chronic acid reflux may frequently experience phlegm in the throat, especially in the morning or after meals. Additionally, environmental irritants like smoke, pollution, or dust can irritate the respiratory system, causing it to secrete more mucus as a defense mechanism. Smokers in particular may develop chronic phlegm buildup due to regular exposure to smoke and other harmful substances in cigarettes. In some cases, lifestyle habits like poor hydration can thicken mucus, making it more noticeable in the throat. Dehydration can dry out the mucous membranes, causing mucus to become sticky and less easily cleared, contributing to the sensation of phlegm in the throat. Cold, dry weather can also have a similar effect, leading to increased mucus to keep the throat and respiratory tract moist. For individuals with asthma or chronic respiratory conditions, inflammation and constriction in the airways can lead to increased mucus production, as the body attempts to keep airways lubricated, resulting in chronic phlegm. Identifying triggers like allergens, irritants, or foods that worsen reflux can reduce phlegm in the throat, allowing for more comfortable and clear breathing. Understanding these causes can help in managing phlegm buildup effectively. Which is why we now must discuss how to treat, prevent, and manage this unwanted symptom. Preventing and alleviating phlegm in the throat involves addressing the underlying causes and making small lifestyle adjustments that promote respiratory comfort. Staying hydrated is one of the most effective ways to keep mucus thin and manageable, as proper hydration prevents the mucous membranes from drying out and creating a thicker, more noticeable phlegm. For those prone to postnasal drip, using a humidifier can help maintain moisture in the air, which reduces irritation and mucus buildup in dry environments. Avoiding known irritants like cigarette smoke, pollution, and harsh chemicals can also reduce phlegm production, as these substances often cause the respiratory system to secrete extra mucus to protect itself. Managing acid reflux is also important. Eating smaller meals, avoiding trigger foods such as spicy or acidic foods, staying upright after meals can help prevent stomach acid from reaching the throat, which reduces the likelihood of excess phlegm. For those with allergies, preventive measures like taking antihistamines or using saline nasal sprays can help minimize postnasal drip, which is a common cause of throat phlegm. Warm fluids such as tea or broth can also be soothing, as they thin mucus and make it easier to clear from the throat. Additionally, practicing good vocal hygiene, especially for individuals who frequently speak or sing, can prevent vocal strain and irritation, reducing the urge to clear the throat and subsequently minimizing phlegm. If symptoms persist or worsen, consulting a healthcare provider can help rule out chronic conditions that may require more specific treatment, such as asthma or chronic bronchitis. Taking these steps consistently can significantly reduce phlegm in the throat, allowing for a clearer and more comfortable airway. But as you can see, in most cases, managing and reducing phlegm in the throat can be accomplished with some simple lifestyle adjustments, such as staying hydrated, avoiding irritants, and managing any underlying issues like acid reflux or allergies. These approaches can make a noticeable difference, allowing your body to produce and clear mucus naturally without excessive buildup. Whether it's using a humidifier to keep airways comfortable, sipping warm fluids to soothe the throat, or addressing environmental factors that trigger mucus production, taking these small, consistent steps can significantly reduce phlegm and improve your overall respiratory comfort. However, it's important to recognize when persistent phlegm may indicate a need for medical attention. While occasional phlegm, especially in response to common triggers, is generally normal, chronic or unusual symptoms warrant closer inspection. If phlegm in your throat persists for several weeks or appears discolored, such as yellow, green, or blood-tinged, it may be a sign of an underlying issue. Additional symptoms like chest pain, difficulty breathing, fever, or wheezing can also indicate a health concern. In these cases, professional evaluation is recommended, as it may point to an infection, chronic respiratory condition, or other health issue. Frequent phlegm, especially if it interferes with daily life, can also be linked to chronic conditions such as asthma, bronchitis, or GERD, each of which benefits from targeted treatment. Seeing a doctor in these cases allows for accurate diagnosis and tailored treatment options, which can alleviate symptoms and prevent potential complications. Taking a proactive approach to respiratory health not only clears up phlegm more effectively, but also supports long-term health and comfort. Whether phlegm is a mild inconvenience or a more persistent issue, understanding the causes and solutions helps keep your airways clear and your breathing comfortable, enabling you to enjoy each laugh and breath without the disruption of phlegm. If you want to support the channel, please like and subscribe. I would greatly appreciate it. And there should be some other helpful videos popping up on your screen right about now that I think you will enjoy. And just a quick reminder, we are not doctors. This video is for informational purposes only.